This is St. Louis on the Air from St. Louis Public Radio. I'm Elaine Cha. This week, more than 500 federal and local first responders converged in the St. Louis region to practice for an 8.4 magnitude earthquake and everything such a disaster might bring. That meant drills in managing damage to buildings and infrastructure like bridges, handling chemical contamination hazards, and taking care of injured civilians. One of the people who participated in these disaster preparedness exercises this week is Samantha Lewis, Executive Director of the St. Louis Area Regional Response System. And she's here now to discuss why such large-scale practice is necessary and what lessons have come from it. Sam, welcome to the show.
Thanks for having me.
So let's start by laying a little bit of groundwork, as it were. The St. Louis Area Regional Response System, or STARS for short, has been around for about 20 years now. What does it do, Sam?
Yeah, STARS is a collaborative of a lot of different first responders that work together for preparedness efforts. We have everyone from law enforcement to hospitals and healthcare, fire, EMS, that all work together to really try to make sure that the St. Louis region is prepared as possible. So doing everything from grants together to doing training, exercises, all of those kinds of things, putting plans together so that we are as resilient as possible.
Mm-hmm. And you work with many governments, right?
Yes, we work with a lot of different governments. STARS includes several counties in both Missouri and in Illinois. And then on top of that, we work with some additional partners outside of that for different grants that are even in the more rural areas.
Mm-hmm. Can you give us an example, Sam, of a time when an incident in the St. Louis region activated STARS?
Sure, yeah. I know that one of the things is working through COVID. I know that everybody was pretty much activated during COVID. But one of those was working with our healthcare partners as well. We have several different operational organizations that kind of work together with the hospitals. We have some response branches with that, so they would be able to work together to kind of coordinate logistics of resources, things like that as well. And then there's other things too that happen all the time where there may be some STARS resources used, like search and rescue, swift water rescue, that kind of stuff as well. Then we'll have a lot of different STARS equipment and STARS partners respond as well.
What are some of the challenges with working in particular with healthcare systems?
With healthcare systems, I think that there's so many of them, and it's really amazing working with STARS because they work so well together. One of our subcommittees is focused on hospitals and healthcare, and they collaborate on a regular basis where they're meeting and they're having these conversations. And so getting all of those players in the same room, and they're all very busy, but they all take the time to really work together and have a good coordinated response. So that's been amazing to get to watch and get to know all of them and how they operate, and that they're able to work together to be resilient for the community.
Mm-hmm. Now, you mentioned the pandemic, but what are the kinds of disasters, natural or man-made, that would necessitate a coordinated response?
Absolutely. One of the things that we do with STARS and with all of our stakeholders that are involved is what we do. We do what's called threat and hazard identification and assessment, and risk assessments. And that goes through and looks at what are the different things that could severely affect the region and how do we respond to those. So we'll look at everything from severe weather like flooding to potential, terrorist attacks, anything like that, and kind of sit down together, any range of natural or human caused hazard, and really look at what are our capabilities, what are the areas we need to maybe do some more training in, or we need to write plans for, or we need certain equipment for. So we'll kind of do that risk assessment, see where we're at, and then what we need to be able to be as resilient as possible and really have a good response for the community.
Mm-hmm. So how is it that what STARS is doing is different from the kind of mutual aid, so to speak, that you might see across law enforcement agencies or fire departments?
There are a lot of similarities as far as, kind of that coordination and working together. I think with STARS, it's a little bit different because you have a regional approach to it. So whenever we're meeting as STARS, when we're meeting, say, our law enforcement group is meeting, it includes partners from across the St. Louis region to be able to work together and say, what are the needs of the region? Mm-hmm. There's always going to be needs for individual communities if if you work for St. Louis County, for example, then you're going to have some of those priorities that are set up by what your community needs. But being able to look at it from a regional standpoint too, we can really collaborate and say, what is the best thing we could do across the board regionally? Mm-hmm. That may include sharing personnel. It may include working together to get a piece of equipment or something that we need that we can then send wherever it's needed. So if it's one piece of equipment or something that can be at St. Charles, but it can be shipped over to Madison County, wherever it's needed, that kind of thing as well, as it makes for great coordination and being able to share that stuff as well.
Right. So in the introduction, we mentioned that more than 500 local and federal first responders were in the St. Louis region to engage in this practice for disasters. But it was the first time St. Louis had been selected for this type of training. Why was St. Louis chosen?
So I know Task Force 46 does this, and they've done this in several different major metropolitan areas. This is the first time that we've done it was with the St. Louis region. And one of the things that they look for when they're setting up this exercise is a big metropolitan area that they can work with and kind of collaborate. And really, St. Louis is set up perfect for it, especially with STARS and having these networks already established of these professional organizations that can come together and really build this out and work together on it. Mm-hmm.
Now, speaking of Task Force 46, among those who came to St. Louis for this practice was a contingent of the U.S. Army National Guard. And joining us now to talk more about that, we have Major Kelly Hudson, Project Officer for the Michigan-based U.S. Army National Guard's Task Force 46. It's a mouthful. Major Kelly Hudson, welcome to St. Louis on the Air.
Good afternoon. Thanks for having me.
Thank you for joining us. Major Hudson, what is it that Task Force 46 does?
So Task Force 46 is headquartered in Lansing, Michigan. It's an enduring headquarters of a consortium of National Guard units and a couple of reserve units from 10 different states. And what we do is we constantly train to be prepared to respond to a municipal area such as this in response to either a natural disaster, a chemical, biological, radiological, nuclear, or environmental incident, where we would come in and we would synchronize with the local first responders, and we would augment their abilities, and we would stay on site until the response was complete and the local government is taken back over. We're there totally to work for the civil authorities and augment their capabilities.
Mm-hmm. Now, one of the highlights of this week's drills was responding to a hypothetical 8.4 magnitude earthquake near Busch Stadium. Can you walk us through some of the circumstances around that drill and how everything that you described that Task Force 46 does, how did that all work together?
Absolutely. And first, a caveat for anybody that might just be joining, this is and was just an exercise. We don't want an H.G. Wells
right.
type situation, so just an exercise for sure. But the scenario was that there were a little over 44,000 fans inside Busch Stadium during a baseball game when the 8.4 magnitude earthquake struck along the New Madrid Fault. Several states were impacted, but St. Louis, because of its population density and location, was really at the epicenter of the response efforts. Around 14,000 casualties were able to self-evacuate from the stadium. It left a little over 30,000 inside. And unfortunately, in this scenario, about 12 miles from Busch Stadium, there was also a freight train derailment, and that was carrying toxic chemicals, including vinyl chloride. In this scenario, as we wrote it, the prevailing wind blew that vinyl chloride over the stadium. So now you've got a very complex situation with citizens trapped inside Busch Stadium with various and sundry physical injuries, typical trauma you would see from a structural collapse or damage after an earthquake. But you also now have the complicating factor of the vinyl chloride exposure. So the first step for us is to do a reconnaissance in the building to make sure that it's structurally sound enough to enter to provide aid and assistance. And we do some augmentary structural reinforcement with bracing and blocking to make sure that the entries and exits are safe. We do that first. We test the air and the ground to see what chemicals may be in the area so we know what personal protective equipment to wear, and also it gives us some insight on what kind of care the casualties would need when they get extracted. The next step is removing the casualties, and we had live role players to simulate, and we also had mannequins with casualty cards, and we would bring them out either by rope work from the top levels or downstairs in the ramps to get them out of the stadium and then across the street to where we had established a mass casualty decontamination site. And we do an ambulatory, a non-ambulatory lane, and that is to clean them to make sure that there's no toxic residue so that they're safe to be moved onward to hospitals for follow-on medical care. And then we simulated that with both a local EMS and fire department ambulances transporting them to local hospitals, and several local hospitals participated. And then we had Missouri National Guard helicopters that were doing hoist operations, hoisting mannequins into the helicopters. They were dropped off at local hospitals with casualty cards, also to simulate what injuries they would have occurred, to have them notionally admitted into the hospital and treated. So it's the entire continuum of care from arrival to transport to the hospital.
Mm-hmm. So insofar as decontamination is concerned, why is that important before anything gets sent to the hospital?
Well, it's critically important, one, because we want to get the patient cleaned. We don't want there to be any residual effects from whatever they were exposed to, and then we certainly want to minimize any effects thereof. But in addition to that, you don't want to spread anything. So if you were to put a contaminated citizen into an ambulance or a helicopter, depending upon the type of contaminant, you couldn't reuse that vehicle, and you might actually be spreading the contaminant as you got them to the hospital, and you want to contain that to the greatest degree possible, and that's why we run them through the decontamination process.
Mm-hmm. Now, Major Hudson, insofar as gauging success of these drills, I mean, I think about sort of the most basic thing is what kids do at school or what we might do in a workplace, and success is whether people have left the building. How is it that you gauge success of these drills, and was the one that was done at Busch Stadium successful?
It's a great question. So I would begin by saying it was extremely successful, and that's based upon our goals and our collaborative goals coming into the exercise. So some of what we wanted to learn was who were the key players in St. Louis, how could we be seamlessly integrated into a response effort. You know, there are a lot of organizations, as Sam mentioned previously, involved in this exercise, from military to civilian. We all have our own sets of acronyms, our own verbiage and dialect. We wanted to make sure that we could break down all those barriers, again, in support of seamless integration. And there were so many positive lessons and takeaways from this exercise on a macro level. Organizations such as STARS and the East-West Gateway Council of Governments are critical and provide great assistance for interagency coordination and public messaging, so that was extremely successful. Mm-hmm. And then identifying response staging areas such as Jefferson Barracks, which we used for this, and we could also use the airport. That's essential because we bring so much personnel and equipment into an area for a response such as this. It's a logistics challenge, so knowing where we can go to stage and then move out in serial to the response site is critical. So from a macro level, those were wonderful takeaways from this exercise. On a micro level, tactics and techniques that get shared and learned between military and civilian first responders make everybody better at what they do as they continue to hone their field craft. This just accelerates interagency integration on site, which again saves time and ultimately lives.
Mm-hmm. Sam, what was it like for you to see all of this? I mean, it was playing out again as a scenario, but to see all of this happening.
Mm-hmm. Yeah, it's our responders are great about doing exercises. We do exercises all the time, but we don't always get to do full-scale operations like this. A lot of times when we're doing an exercise, it's putting a group of our responders and our officials around a table to discuss, hey, if this were to happen, what steps would we take? What would we need to do? So what was really great about getting to see this is actually getting to see everything in action and being able to watch our locals integrate with Task Force 46 and the other military personnel that were able to be here to kind of show not only talking through how we would do this, but getting to actually put hands on and practice those techniques like Major Hudson mentioned, being able to actually practice this through from beginning to end to make sure that we know exactly what we're doing. Should we ever need to do it in a real world scenario, then we're just even more prepared for that.
Right, right. Major Hudson, another drill that was done, it involved doing a river crossing of the Mississippi River from St. Charles to Grafton, which would potentially be necessary if bridges were damaged. What did that drill entail?
Yes, that was an interesting vignette that we had incorporated during an exercise we did last year in Nashville, and we wanted to bring to the table in St. Louis as well. So the 1438th Multi-Role Bridge Company out of the Missouri National Guard, which is a tremendous asset to the state, and exactly as you said, in a scenario such as this seismic event, bridges are damaged or maybe completely destroyed. First responders and emergency personnel have to be able to get from one side of the river to the other. And without being able to do a quick structural assessment of those bridges, the best way to do that is through use of the multi-role bridge company. And so what we did was utilize helicopters to drop bridge bays into the river, and then some of the MRBC multi-role bridge company boats to actually push those bays in essence forming a ferry to take ambulances, fire engines, and emergency personnel back and forth across the river to make sure that they could render the aid needed.
Mm-hmm. So far, what we've been talking about has to do with what agencies and first responders are doing. How about just regular people? How is that accounted for, Sam?
Yeah, there are so many tips out there for people to be prepared. Everyone has a local emergency management office or a local emergency management agency, depending on where you live. It may be the city, it may be the counties, but they have a lot of great information that they can share with citizens about things like having go kits so that you're ready. One of the things we talk about a lot in preparing for a major disaster like this is that it will take time for someone like Task Force 46 to come to our aid. So given that, if it takes a little bit of time for responders to get to you, one of the things that we teach is having a go kit ready, which is like 72 hours of everything that you could need, from food, water, batteries for your flashlight, pet food, pet needs, having basically 72 hours of a go bag ready so that you can kind of help your needs, you can help your family, you can help your neighbors. So there's a lot of different programs that the emergency management offices put out there. There's CERT, which is the Community Emergency Response Team. You can get training through your emergency management offices. They will go over things like the Go Kits. They'll teach you how to put out fires. They'll teach you how to do some basic first aid. So there's a lot of great opportunities out there that you can reach out to your emergency management offices, anyone like that can kind of help steer some additional messaging and some additional resources that you can use as a citizen to make sure you're prepared as well.
Mm-hmm. Major Hudson, I want to return to something that you had mentioned earlier, and that was about disaster preparedness drills in other places. And you talked about Nashville last year. To what extent are circumstances in this region similar or different from the circumstances that are present in preparing for a disaster in a place like Nashville?
Sure. Well, to begin, we've done disaster exercises such as this one in multiple cities, including New York twice, Los Angeles, Detroit, Philadelphia, Nashville, and now St. Louis. And the similarities between Nashville and St. Louis and the scenarios written in support of those exercises is that they're both on fault lines. They're both prone to two seismic events. Something that's unique to St. Louis as opposed to Nashville is, age of the infrastructure. Nashville is a very burgeoning, developing area. You've got, the state bird of Tennessee, I think, is a crane because there's always construction going on in Nashville. And so that poses its own unique challenges. Whereas in St. Louis, you've got a little bit of an older infrastructure, and with the red brick buildings, they're a little bit more prone to damage during a seismic event. And so the way you would respond to what would appear on its surface to be the same event would be different because those would manifest very differently.
Mm-hmm. And is that something that once you got here, you could see more of? There's obviously the information that you can glean, but once you got here, Major Hudson, was that sort of accentuated? And Sam, also for you, did this come up as something that needs to be addressed such that we would be better prepared for disaster in the future? We'll start with you, Major Hudson.
Yes, absolutely. So, months of planning went into this exercise, and that's something that every time we paid a visit to St. Louis and we met with the STARS personnel and local and emergency fire and police department officials, it's something that was definitely on their minds and so ours as well. So that pre-exercise integration to know what their concerns were, what they see on a daily basis, the propensity for fires and what happens during a fire in St. Louis, a house fire, a building fire, and how it's similar or different from a building or house fire someplace else. Mm-hmm. That definitely accentuated how we wrote the scenario and how we planned our notional response.
Right. Mm-hmm. So, Sam, as far as that point about being prepared and what is it that can be done?
Yeah, that is definitely something that is also on our responders on their minds, and something that they keep an eye on as far as something to consider as a potential risk with some of our aged infrastructure and things like that. And there are definitely conversations that happen around how that may affect response, what the safest way to do some of those things are. East-West Gateway Council of Governments is also working on updating the state, mitigation plan for Missouri, and the St. Louis component of that mitigation plan, and some of that also takes into consideration some of those factors as well as things like that too.
Mm-hmm. So with these disaster simulations, we're talking about what could go wrong and what needs to be ready in order to deal with those things. And we have talked about what went well. What is one thing, though, that is an area to improve? The biggest area of something that has the greatest potential to help us be better prepared. Major Hudson?
I'd say communications is always the thing that worries me the most. In any type of an exercise and a preparation for a disaster response, and we like to say perfection is the goal, but excellence will be tolerated because, you're never going to be perfect. And I think the Achilles heel of any organization in a response like this is communication, either limited number of radios or agencies that work on different frequencies. But I think for the citizenry, it's our societal reliance upon the cell phone. It's a wonderful tool, and it's a great way to get messages out. But if a seismic event were to occur and cell towers were damaged, how do you get information out to the community about where they can go get food and water? How do you let people know where the rescue efforts are taking place, et cetera, et cetera? And that's always the thing that's on my mind is how can we increase and have positive redundancy for communications platforms?
Mm-hmm. Is there anything you want to add to that as we close?
I would agree definitely with Major Hudson. I think communication always comes up as an issue, or maybe not even as an issue, but something that can definitely be improved upon, everything that he said. The only thing I would add, too, is just that coordination. When you have such a major area, so many different things in St. Louis, if we were to be affected by a major disaster like that, we have to make sure that we're working together to coordinate where our resources are going. We only have, so many search and rescue teams we can send out or so many different things. So we have to be able to work together and coordinate where the highest priority is and, what other resources do we need to request? Do we need to request Task Force 46 to come in? Different things like that are also going to be something that we continue to look at and work on and practice and train for.
Mm-hmm. Samantha Lewis is the Executive Director of the St. Louis Area Regional Response System, and Major Kelly Hudson is Project Officer for the Michigan-based U.S. Army National Guard's Task Force 46. Major Hudson and Sam, thank you so much for joining us today.
Thank you.
Thank you. My pleasure.
Today's episode was produced by our executive producer, Alex Hoyer.
Audio engineering and podcast design by Aaron Dorr.
St. Louis on the Air is a production of St. Louis Public Radio. Understanding starts here.
Do you find yourself regularly listening to episodes of St. Louis on the Air? Suggest us to a friend you think might enjoy our conversations. And leave us a review and rating on Apple Podcasts on the App Store. It's the simplest way to help people discover our show. Thanks.
St. Louis Public Radio is a member-supported service of the University of Missouri St. Louis.
The Gateway brings you the day's news each weekday from around the St. Louis region and the state capitals in Jefferson City.
Our schools are accredited. We don't need this bill.
And Springfield.
How many more years must pass before lawmakers see time is of the essence?
I'm Abby Larico. Join me each weekday for The Gateway on the STLPR app or wherever you get podcasts.